Filler fear part 2, complications. What could actually go wrong? Well, the most common complication that you could have is actually not looking like yourself, right? You can get overuse of injectables. Using fillers to try and lift the skin doesn't work. Fillers are for volume loss and volume restoration. You can change and restore the architecture of the face, but you're not lifting tissue. And unfortunately, in the over-commoditized injectable world that we live in, there is a lot of misuse of the product. So the biggest risk is an aesthetic one. A lot of people can get what's called filler fatigue. With an overuse and overfilling, it could actually cause a stretching of the skin. Particularly hyaluronic acid fillers can retain a lot of water and create a advanced dowiness of the skin, which is something that happens naturally anyway. We lose the elasticity, so it can create this kind of paunchy puffiness of our skin. That's true of hyaluronic acids. With biostimulatory fillers, if you overabuse things like Sculpture or Radius, you can create increased scar tissue. Again, the appropriate amount of product for the appropriate indication and patient is very safe, very predictable in the right hands. Other complications that can happen are obviously more medical ones. We always worry about filler of any kind either getting into a vessel or compressing a vessel that actually is vital to bringing blood to part of the skin. So if you actually get a filler of any kind in that vessel or compress it, you're basically going to starve the distal tissue of oxygen, and that can create a problem called necrosis or hypoxia. Now, the good news is hyaluronic acid-based fillers are reversible. So if you have a good provider that can recognize the signs of compression or occlusion early, it can be treated and fully reversed. This complication could happen sometimes in the best of hands. There are certain things with technique and knowing where to inject, how to inject, what plane to inject. There are certainly several things that an expert injector can do to minimize that risk, but sometimes lightning does strike. It is extremely rare. And again, when it's recognized with an appropriate provider, you could often really prevent any permanent damage. There are very few cases in the literature. People always come in asking of blindness. These are very, very rare. You probably have as much of a chance of getting hit by a car or lightning walking down the street, but it is a considered complication. Again, this all reminds us that the most important thing you can do when getting a filler is choosing the right provider. Also, choosing a provider that has several options for you, because injectables, particularly fillers, are not the answer to anything. There are so many different reasons why we get older and look older, and volume loss is just one of them. So fear is probably not the right word, but caution is. And hopefully we're learning now the pros and cons of how to inaugurate fillers into an overall combination of treatments to make you the best version of you.